the beginning of the year, I noticed that I was having heavy bleeding. It was for a few years. Just sitting at your desk trying to figure out how to maneuver 2 heating pads.
She had a total laparoscopic hysterectomy with what's called a bilateral salpingectomy. We removed the fallopian tube simultaneously.
We did the ultrasound to see what was what, and he was like, yeah, you have some pretty big fibroids.
Excuse me, people with heavy abnormal uterine bleeding, maybe endometriosis or symptomatic uterine fibroids. So those are the usual candidates that we see. So whether it's pain related or bleeding related, that's classic in this particular specialty. The platform of using a robot just allows the physician to work on really both sides of the table simultaneously. In addition, it gives you 3D vision, so you have binocular vision as opposed to monocular vision.
Now let's just look at that fibroid for 1 second.
We call it degrees of freedom, so it's a matter of being able to manipulate or move the instrumentation. It's sort of like your wrist and being able to move it in different planes. So when I get to the console, I'm able to manipulate both sides of the table. So sometimes I think the misnomer is that patients think the robot is doing the surgery. It's not. It's like using a miniature hand inside there, but you have both of them. And actually you can manipulate 3 different instruments while you're inside.
We're gonna take a quick peek at the other side.
Then I found out it was the first for Atrium Health and Union for that particular procedure. So I was like, oh, at first I'm like, okay, I didn't know, what to say. And then she said, well, you're making history. I was like, wow, okay.
It minimizes blood loss. It's just in general, I find just a better outcome for patients in general.
It was all done and I would have so much relief of that. I wouldn't have to worry about the bleeding or the pain or the fibroids. I am very glad I did it.